So now let's look at the current year 4 psychiatry course. And just a reminder that this is for context, and we don't want this to be presented as the way things have to be. It's just the way things are at the moment for your context. So we've seen how psychiatry is woven into all of the 5 years of this MBCHB course, but mainly the second and the fourth. And so what we're looking at right now and what we're looking at co-producing in this project is the 4th year psychiatry course. So the 4th year psychiatry course sits as one of the 5 different placements that students go through during 4th year. So the other placements are complex care of the older person, that's geriatric medicine, reproductive health, so obstetrics, gynecology, and care of the newborn, and then child health or pediatrics, and acute and critical care. From September 2026, both the mental health and complex care of the older person, or CMOP, modules will last 9 weeks, whereas the others will last 6 weeks. And students will spend 1 day per week in both of the 9-week placements going to work in a GP setting. So that day in the GP setting sits outside of the curriculums for the mental health and CMOP placements. So there are national curricula and assessments that guides our curricula in psychiatry in 4th year. These are the assessments we've already mentioned a little bit, so that students sit both of their final exams at the end of year 4. There is a clinical assessment, a practical assessment called an OSCE, and the content of this is set by the University of Bristol. However, it has to be approved by the GMC, which is the General Medical Council, the regulatory body for doctors. There's an approval process there which is national and beyond the university's control. The written exam, the MLA, is, as of recent years, set nationally rather than by the university. And I've provided a link to the content map for the MLA both on the slides here and below the video. So just to say a little bit more about these kind of big exams that happen at the end of the 4th year. So an OSCE, as I said, is a practical examination. And what it looks like is the student going through a set of what's called stations. So anywhere from about 7 to 10, 12 stations over the course of a day. And at each station there is a clinical scenario. So it might say, please take a history from this patient with chest pain. The student then has to, so in that station, do the clinical task. So in that station, take a history, speak to the patient and find out what's going on. And in the station itself, there would be an actor playing the part of the patient and an examiner going through a mark scheme to ensure that they got all the relevant points in the history, and there would also be points awarded for instance, good communication skills. And then students would need to pass a certain number of stations and achieve a certain number of points in order to pass the exam. So the written exam, the MLA, like I said, is a nationally set exam. It's a multiple choice exam and focuses more on theoretical knowledge rather than clinical practice, although most of the questions, or many of the questions, will be clinically linked. So then there are 2 curricula that kind of guides what we can do within our psychiatry course. So one consideration is that students, there's the GMC, the General Medical Council, mandate that students need to develop their practice that is in line with the principles that they outline in their Outcomes for Graduates document, which again I've provided a link to below. And there's also a requirement that all university psychiatry curricula should align with the Royal College of Psychiatrists kind of guideline curriculum that they produce. So within the structure of the placements in the year, the structure set by the examinations and the external curricula sits the Year 4 psychiatry course, and that is the subject of our project. That is what we are working on and co-designing during these weeks. We do, as you can see, have some external guidance and criteria, but as we'll come back to at the end, we do have a certain freedom to interpret these and fulfill these in a way that we choose. So let's talk about the course itself, which includes a placement and teaching, supervision. What does it look like at the moment? Where are we starting from, if you like? So when we say placement, what we mean is for students spending time during the working day with both community and inpatient teams. And when placed with teams, they may be shadowing team members doing consultations. They may take part in consultations in a kind of structured or more informal way, depending on their ability and the preferences of the clinician that they're working with and the patient that they might be seeing. Clinicians that are shadowing on placement may also provide informal teaching. And I guess to say they maybe would often shadow doctors in clinics, but not always. They would also shadow other members of the multidisciplinary team. So they might be going out on visits with nurses or healthcare assistants, spending time with a pharmacist, etc. On the wards, students would probably be spending time sitting in ward rounds, speaking to patients, and then talking to a member of the team about their conversation and reflecting on it, as well as practicing doing histories with patients on the wards if the patients are kind of happy for that, and then discussing these and getting some feedback on how they've done from the doctors on the wards or other members of the team. So that's what kind of being on placement looks like from a bird's eye view. So students are on placement with clinical teams in lots of different areas across the southwest, and this provides them with kind of a diverse experience. But there's also some difference and disparity there, in that some students will be placed in a kind of busy central city hospital and others in more rural areas. And the aim is for students to stay with teams for around 3 weeks, usually, which enables them to build up a bit of a working relationship with members of the team. And hopefully that allows them to get a bit more out of their time there. So the typical student week during the psychiatry module, psychiatry course, doesn't just consist of these placements. What I've described in the previous slides around placements is the core clinical placements. That would be, they'd do that on a Monday and Tuesday, and then on Wednesday they would have kind of go out of the psychiatry course to do a day on GP. As we mentioned before, that's not part of the psychiatry course, but then they would come back into psychiatry on the Thursday for a teaching day, which we'll talk a little bit more about. Then on Friday there's space for students to have kind of clinical shadowing experience with teams or with services that are doing something different to their the team that they usually place with for a bit more time on Monday and Tuesday. So this could be going to see ECT happen, for instance, or going to a forensic setting for a day, forensic mental health setting for a day. So each of the 9 weeks for students will follow this pattern. Although they may do things on slightly different days, they would always get 2 days of core clinical placement, one GP day, a teaching day, and then another day to do have some different clinical shadowing experiences, placement experiences. So what in terms of teaching students provided with over the course of the Year 4 psychiatry course? So just to say, I'm going to do another video on this for those who want to go into a bit more detail, but I'll give an overview here. So we divide this up into weekly teaching sessions that are available to students, and then also things that happen on a once-only basis during the 9 weeks. So in terms of weekly sessions, students will be offered one case-based learning session. We talked about case-based learning a little bit already, but in essence they'll work through a case as a group with a teacher who kind of acts as a facilitator for the group to think about questions relating to a kind of made-up patient case, and these patient cases follow a kind of diagnostic themes for each of the weeks, and you can see the themes on the slide there. So following the case-based learning, it's usually about 90 minutes it's been spent at CBL, and following this they will have a clinical skills session where they practice history taking and consultation skills with each other, with the teacher, or sometimes in some areas they employ actors for the clinical skills sessions, so that students can practice history taking. And there are history taking kind of scenarios that are written that go along with the theme of the CBL for that week. The third regular session that happens for the students every week is that they'll have a tutorial with the undergraduate tutor for around an hour a week. So the undergraduate tutor, for context, is the kind of head of teaching in the local area and will be responsible for around 6 to 11 students at a time. And the tutorials provide a kind of pastoral role for the tutor to check in with the students around how things are going. Some tutors run a reflective group to fulfill that role, but I think other tutors, most tutors tend to use it for a little bit of teaching time as well. So what the tutorial is in practice kind of varies a little bit, teacher by teacher, area by area. So then there is the sessions that happen once each placement. So right at the start of the placement they have a day of just 3 lectures, about 90 minutes each. So one is on psychopathology, which is kind of the terms and words that we use to describe, note down, understand people's experiences or mental health symptoms in psychiatry. And then there's a lecture on history taking and mental state examination. So basically the form that speaking to patients, understanding their experience in kind of psychiatric terms. And there's also a lecture on the Mental Health Act as well. And then once in every placement, students are offered a half day doing a sim session. So sim stands for simulation, and the idea of this is that students work in pairs to work through acted or pretend clinical scenarios where an emergency is happening. So it might be that students teachers facilitate a scenario where students walk into a room and someone's collapsed, and then they have to pretend it's a real life situation and do the things that they would do, or say the things they would do. For instance, saying, I would take blood from this patient, I would call an ambulance, and they might have to act out calling an ambulance with one of the teachers being a paramedic on the phone, for instance. And then at the end of the placement, students have an opportunity to do a mock OSCE, which they don't have to do, but it's offered. And the mock OSCE is a shorter and mock of the real exam, which they'll complete later in the year, which we've mentioned. So just for a little bit more context, we mentioned undergraduate tutors. But in each of the different localities in the trust where students are placed, the undergraduate tutors also work with usually psychiatry trainees who take on kind of teaching roles for a year or so, and they're called the associate tutor and junior associate tutor. So maybe not something you have to remember, but I guess for a little bit of context if those terms come up elsewhere. Maybe I'm slipping a bit into teacher mode here because I think none of this you have to remember. As I said at the beginning, this is for your context, for your interest really, and set context for the work we're doing. There's a lot of information, so please don't worry if you don't remember it. There'll be people from the group who know this if needed. But for a bit more context, there's also the university also sets at the moment sets the following requirements for the students to kind of pass the placement. So they have to have done and got signed off by a doctor that they've kind of done 4 clerkings, which means speaking to a patient. This could be on the ward, or could be in a clinic setting, and that they've kind of taken a full history. And they've presented that to a doctor who then signs it off. They have to practice writing a letter to a patient, which is like the letter a psychiatrist would write to a patient after they see them. They also have to have attended a session about learning disability, I'm not sure whether that's and an ECT session, but they have to have done a kind of extra kind of special interest session as well. They have to have observed or discussed the management of someone who is agitated. Agitated is a word, kind of psychiatric word, one we use for someone who is distressed, upset, maybe aggressive. And they have to have had a discussion with a doctor about their formulation of suicide risk. What do we mean by formulation? We mean thinking about quantifying and describing someone's kind of level of risk of suicide, you might say. So students also keep a patient log, and they have to have noted down 20 different patients that they've had an active role in their care. So it might be that they've been in clinic and or in a ward round and they've been part of a conversation with a patient, and they note that down. And that's not something that's signed off, but students kind of keep themselves, and it's a requirement that they do kind of complete that, get to 20. They have to have attended all of the CBL, clinical skills and sim sessions, and if they're ill, there is a process for kind of making that up, I believe. And they have to have completed a personal reflection on the job as well. And then there are requirements that they attend at least 80% of the sessions and engage in a professional manner. So as we alluded to, we're working on the Year 4 psychiatry course, and there are certain kind of overarching structures which we don't have the power to change within our group. So it's a bit of a summary. So the university stipulate the medical school uses CBL as a format, so that would be something that would be non-negotiable, that we use that kind of format, but the content of the case is totally up to us. The topics covered, all of the detail is up to us. And the mock OSCE, there's a requirement that should be offered. As you said, we can't change the contents of the national curriculum, but we actually have quite a lot of leeway as to how we interpret the national curriculum, what we focus on, so that gives us quite a lot of flexibility, really. For the GP days on the Wednesday, we can't really stipulate the curriculum there because it's not part of the psychiatry placement, but they may be open to suggestions. And the length of the placement kind of has to stay at 9 weeks to fit within the everything else the students have got that year, but we can change what we mentioned on the previous slide about what students have to do to pass. So that's not an exhaustive list of what we can change, but that's a list of some of the important things that we can't change, I guess. So these are some considerations which were taken into account in the designing of the current course. So they will probably come into our discussions in the working group as well. So if we're designing a curriculum, we might want to consider that there are lots of different sites within that the curriculum is delivered at, and thinking about designing something that can be delivered fairly equitably at different sites where university students are placed. There are obviously limitations to the budget. the university has to provide teaching and that the trust has to provide teaching. So that might be a consideration. And the third thing is that I guess just being might come up in the discussion, but it has in the last few years been difficult to find sufficient kind of numbers of placements, numbers of teams for students to go to. So it might be a little bit hard for us to find lots more. So these are the kinds of things that have been thought about in the designing of the current course, and therefore maybe will come into our discussions. Okay, so lots of information there. As I said, please don't feel like you have to remember that all. It's just for context. But if you are interested, there's more information in the links below, and you're also welcome to get in touch with us at any point.